Today we are going to dive into a full mouth, fully guided dental implant rehabilitation. A game-changing procedure for a fast, precise and a minimally invasive solution to restore your smile back. In this particular strategy, the patient is taken into consideration through his 3D models. A 3D imaging software and a 3D image is taken into consideration to formulate a 3D guide which aids into a precise and optimal placement of implants as per the patient's bone levels and demarcating all the soft tissues in it. The implant placement is very precise and optimal using this 3D guide. Unlike the traditional methods which were dependent only and solely on the manual judgment of the dentist, but this 3D guide helps the dentist to overcome all the complications that were associated with the traditional methods. The process usually starts with a 3D digital scan and a 3D CBCT scan which is simulated onto a software which helps the doctor design a guide for an optimal placement of the implants. The implants are designated to a position where exactly they should be. This avoids any kind of nerve damage, any kind of tissue damage, and it also avoids evaluating the nature, the density of your bone for them to take up the implant and integrate with the implant. Once the surgery is done, there is a healing phase of minimum 1 to 2 weeks. The healing is optimum for this patient. Why? Because it is a minimal invasive procedure. Less amount of cutting, less amount of stitching happens during the phase of the surgery. The healing is much more faster and much more precise in such cases. Post-surgery, the aftercare strict instructions are imparted to the patient. Patient follows them, and after a continuous follow-up and after 1 to 2 weeks of duration, a provisional or an interim prosthetic teeth set is given to the patient. Patient then starts using it for a duration of 3 to 6 months. This wait of 3 to 6 months is a very crucial phase. Why? Because the implants take at least 3 to 6 months of binding to your bone. The healing for this patient is faster and the integration of the implants for this patient is faster as it was a minimal invasive technique. In conclusion, this is a groundbreaking solution to restore your smile back with minimal discomfort and a very faster recovery.